We are joined now by Admiral Brett Giroir from the White House Coronavirus Task Force. Admiral, thank you for joining us again this morning. You know, the president also said this week that we're in a good place with the virus, but the U.S. has set a single-day record for new cases 7 out of the last 12 days, and the death toll is rising. Can you say we're in a good place?
So thank you for having me on, George. We are all very concerned about what the virus is doing right now. We are in a much better place than we were in April because of a lot of things. The testing could allow us to identify a hotspot. We have surge teams, CDC teams, response teams all going to places. We're in much better place for our PPE across the board. We have new treatments. So look, we are all very concerned about the rise in cases. No doubt about that, and that's why we're meeting regularly. We're surging in assistance, but we are in a much better place. This is not out of control, but it requires a lot of effort, and everybody's going to have to do their part. And you know what you're going to ask me, and that is, you really got to stop the bars. You've got to decrease restaurant capacity. You've got to physically distance. We have to have people wearing a mask in public. It's absolutely essential, and you've got to use good hand hygiene.
Well, let's talk about that mask mandate. We saw the president wear that mask in public for the first time. You're seeing more governors come out and say you must wear masks in our state. The governor of Louisiana did that yesterday. Is it time for a national mandate?
So, you know, I'm not the person who can say who could nationally mandate things, but let me tell you, it's very important that unless you're in a state that is really cold and the percent positives are very low and the cases are decreasing, it is really essential to wear a mask in public. We know that this will decrease your spread of particles to other people. Probably doesn't protect you so much, but it protects everyone around you. And the more data we get about potentially some aerosol spread, particularly in very closed spaces with poor ventilation, it's really essential to wear masks. And for this to work, we have to have like 90% of people wearing a mask in public in the hotspot areas. If we don't have that, we will not get control of the virus.
The president said a couple weeks back that wearing a mask is a double-edged sword. He suggested there could be some harm from wearing masks as well. Is there any downside to wearing a mask?
To the data we have right now, there's no downside to wearing a mask. I'm a pediatric ICU physician. I wore a mask 10 hours a day for many, many years. So we don't believe there's a downside to it. Now, there are very selective people who feel uncomfortable with it. But again, you don't have to wear it 24/7. It's really when you're not around within your home, when you're out in a public space and you can't physically distance. If you're outside taking a walk and you're not close to someone, you don't need to wear a mask. So there is no medical reason except for maybe 1 in a million, that people can't wear a mask according to the guidelines we have.
You're in charge of testing for the task force. An average of about 650,000 people a day were tested over the last week. That's far below the 1.7 million a day it would take to mitigate this virus. And we've seen those long lines in the hardest hit states this week, 13 hours in Phoenix. Why are we still seeing bottlenecks like this so deep into the crisis?
Well, there are about 5 questions in there. We have days that we've tested over 800,000 people, and I would predict in the next couple of weeks we're going to hit over 1 million people, particularly with pooling. The types of tests are getting better. We're having many, many more point of care. And, you know, just because someone says we need 1.7 million tests a day doesn't mean that that's true. We think we have enough tests today to identify where the hot spots are. We know that very clearly because when the percent positive goes up, we know that's a hot spot and we need to jump on that.
Right, but in those hot spots, we're seeing those long lines. We need to work with the local authorities. Well, yeah, yes and no. In some places we are. In some places we aren't. In Phoenix, for example, where everyone talks about it, we have 44 federal sites that are there that can be used in addition to those long lines. We are surging testing there at the request of the governor. And we really have to work with some of the local partners. If you say anybody who just wants to test, who wakes up and has it, do not have any appointment schedule or any hourly schedule, there are going to be lines. We want to support them with logistics. That's why we've sent teams out to 10 localities last week, 9 more this week, and we have CDC personnel in every town. I'm talking to people on a regular basis multiple times a day, but our testing is up. You're going to see a lot more improvements in testing with point of care and with pooling over the next week or so. We expect turnaround times to go down as we lessen the burden of nursing homes, because we have alternate strategies for them to get tested. So again, we need to have as many tests as possible. We have enough right now to identify where the hotspots are. But once you identify it, you've got to do something. And the do something are the measures we just talked about.
Well,
wear a mask, physically distance, wash your hands, et cetera.
Well, that's what I want to get to next, because in those hotspots now are places that reopened early. I want to show a graph from the New York Times showing the astronomical increase in cases in places like Florida, South Carolina, Arizona, Texas, and Georgia since they reopened. You mentioned masks, you mentioned physical distancing, but is it time to consider more stringent lockdowns in those states?
You know, everything should be on the table. What we model are the most important interactions are closing bars. If you're in a red state, I mean, like a red state, red meaning you have a lot of transmission, closing bars is an important thing. Limiting the capacity of restaurants is an important thing. These are two measures that really do need to be done. They really do need to be done. Mask wearing in public, in order for us to reverse this problem, we need about 90% of people in those really hot areas to wear masks when they're in public. Now, let me just say, we are not out of this at all. We're all very concerned, but we have seen this week a leveling of what we call the percent positive. That's our sort of first indicator that if that levels, we're going to start seeing emergency rooms drop, hospitalizations drop. I'm not saying that's going to happen, but I'm saying the measures that we have right now indicate that we're in a bit, you know, we have a lot of cases right now, but the measures we're doing maybe putting the lid on
But
that.
those
Hospitalizations, very concerning. Yep.
But I was just going to say, those positivity levels in the hot states are leveling off at a very high level, a significantly high level. That means we're likely to see the death rate increase even more over the next few weeks, doesn't it?
So look, that's a leading indicator. We expect hospitalizations to continue to go up. What I mean a leading indicator, that's the first thing you see. And when it levels off, it's got to level off before it goes down. We do expect and are planning for and are surging people and everything else, but we do expect hospitalizations to go up. At the peak in April, we were at about 85,000. Right now, we're at 63,000, but we do expect those to go up. And unfortunately, even though the mortality rate, your chances of dying if you get COVID, are way reduced than they were before, because we know how to care for you better. We have remdesivir, we have steroids. Even though the death rate, if you get it, is going down, your chances of surviving are much better. We do expect deaths to go up. If you have more cases, more hospitalizations, we do expect to see that over the next 2 or 3 weeks before this turns around. It's starting to turn now, but we won't reap the benefits of that for a few weeks.
Everyone wants to see kids back in school in the fall. The big question out there right now is how to do it safely. President Trump said this week that he thinks the CDC guidelines are too tough and too expensive. Do you share that concern?
I think the CDC guidelines are really right on target. And we all, you know, they're, quote, CDC guidelines, but we all work on them together. All the docs on the task force, the interagency, and we feel they're pretty strong. I want to emphasize, I'm a pediatrician. We have to do this safely, but kids not being in school risk their social and emotional health, risk many people with nutrition, the recognition of child abuse, child sexual abuse. It's really important to get kids physically back in school, but we do have to do that safely. And the first thing we need to do is we need to get the virus under control. When we get the virus more under control, then we can really think about how we put children back in the classroom. We know from other countries that particularly young children do not seem to spread the virus. We know they don't get sick. So we're learning a lot from looking at Sweden and Finland and Japan about how to do this safely. So it is a health reason to get them back in school, but it's got to be done carefully. The CDC guidelines are good. And the guidelines aren't changing this week. These are more guidelines that are amenable to school districts actually implementing them. The CDC guidelines tend to be a little bit academic and long. These are going to be much more concise so people can really follow them and understand them.
Finally, sir, I was struck by something William Hazeltine, a biomedical executive, former professor at Harvard Medical School, said this week, and I want to put it up on the screen. All people who study these viruses think that the summer is the quiet time. Think about that. If this is the quiet time, I hate to think what winter is going to be like this year. Should we be braced for a stronger second wave, and what can we do now to soften the blow?
So we had no data to suggest that this would go away, and we know 90% of our population is still at risk for the coronavirus. So we were hopeful that it would diminish in the summer, but we didn't count on it. And yes, there is a possibility it could be worse in the fall, and we are all continuing to increase everything we do. I do think in the fall we're going to need tens of millions of more tests per month, and we are planning for that because we'll have a lot of respiratory viruses like flu circulating. Very critical that people get their flu vaccines because we don't want flu circulating with COVID. And yeah, there's some data you can get both at the same time, and that's not really good. We're continuing to work with our commercial partners. The commercial labs have done a great job. They've done over half the testing in this country. They're working on strategies with us around pooling. And finally, we're doubling down on protecting the nursing homes. You'll see a lot of actions in the next couple of weeks of getting point of care testing into the nursing homes at risk. That will decrease the burden on the commercial labs, but also give people turnaround times of 15 minutes so we can control that. So it is all hands on deck. It's been all hands on deck since middle of March. Unfortunately, it's still all hands on deck during the summer, but we are preparing for the fall.
Admiral, thanks very much for your time this morning, and thank you for being so straight with us this morning. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.